The increase of tools and standards to aid evidence-based practice, or EBP, in the 1990s and early 2000s did not immediately translate into widespread adoption by clinicians and healthcare systems. While these tools were welcomed, there remained a substantial gap in understanding how to effectively implement them and the necessary practice needed before their safe usage. By the end of this video, we aim to illustrate some of the barriers to implementing EBP, as well as emerging solutions to address these barriers. Let's explore the real-world impact of this issue through case studies. In one study involving the management of asthma, it was found that when EBP guidelines were appropriately followed, patients experienced fewer asthma attacks and hospital visits, improving their quality of life. However, another study showed a major medical breakthrough, such as a new method of stroke management, took on average 17 years to become an integral part of a clinician's practice. This is often referred to as the 17-year gap. These case studies illustrate the importance of reducing the time it takes for new evidence to be integrated into practice. The recognition of this gap led to finding ways to support knowledge translation. Knowledge translation efforts fall into several categories: passive, pull, push, and prompt. Passive strategies rely on clinicians finding information on their own. In contrast, pull strategies involve healthcare professionals actively working to advance understanding of the latest evidence through activities such as journal clubs. Push strategies disseminate information to clinicians via channels such as conferences and workshops. And prompt strategies utilize tools that suggest specific tests or interventions based on certain patient characteristics. Now, with the advancement in technology, we're able to do more prompting. For example, modern electronic health records can be set up to suggest specific tests or interventions when certain patient characteristics are entered, helping guide clinicians toward EBP. With the continual advancement of technology, we can expect even more efficient and user-friendly tools in the future that streamline the implementation of EBP. For instance, AI and machine learning can enhance the process of sifting through and synthesizing vast amounts of research. Virtual reality could provide practical and immersive training for healthcare professionals on the application of EBP. This brings us to the crucial role of education in improving EBP implementation. Continual learning and development are necessary for healthcare professionals to stay current with the latest research and best practices. This ongoing education can take various forms, including formal postgraduate education, professional development workshops, and even on-the-job training. The role of patients in EBP is also increasingly significant. With growing access to medical information, patients are more empowered and can participate actively in shared decision-making. Informed patients can advocate for care that aligns with the best available evidence, further driving the need for more EBP. Moreover, we have seen the emergence of fields like dissemination science and implementation science, as well as quality improvement methods and biomedical informatics, all aimed at bridging the gap between evidence and practice. Dissemination science focuses on improving strategies to spread information about new technologies and processes, while implementation science aims to facilitate the use of these new insights and tools in practice. Quality improvement methods can help facilitate strategic implementation of new evidence into practice using actionable data from electronic health records. Biomedical informatics leverages technology to optimally use information within the healthcare context, with the goal of improving patient care and studying the value of care. Each of these new fields contribute to our ability to take the EBP model and make it possible in our everyday healthcare settings by helping us consider and navigate the nuances in our environments and organizational context. We hope that this series of videos has helped create an understanding and appreciation of the history of EBP in healthcare, as well as your role in it. In future videos, we will provide a more in-depth consideration of these new advancements in the evolution of patient safety and quality approaches in healthcare.